my name is Ben Levine. I'm a cardiologist and cardiovascular physiologist, and I'm a professor of medicine and cardiology at UT Southwestern Medical Center and director of the Institute for Exercise and Environmental Medicine at Texas Health Presbyterian Hospital in Dallas. This research institute is the largest center for the study of human physiology in the United States. And I put the first heart catheters in an astronaut, which was in Dr. Gaffney, who flew in 1990, I believe, on SLS-1. I think I've been involved in just almost every invasive cardiovascular experiment in the space program. So, one of the earliest problems that were observed, even with short duration space flights, is that astronauts had trouble standing up. In our studies, up to 2/3 of astronauts can't even stand for 10 minutes when they come back, even from a short duration of space flight. And that was really confusing. A lot of effort was exerted to try to understand why should astronauts have orthostatic intolerance. That's the medical term. Orthostatic is the medical term for upright, and intolerance is intolerance. So why should astronauts have that?
Is that POTS or is it just similar?
So that's and I think this is where there is some nuance, right? Astronauts don't develop POTS, but they do have orthostatic intolerance. A lot of the insights that I get about patients with POTS comes from studying astronauts, because POTS is fundamentally a gravity disease. So in our studies, most of our astronauts on the first day back from space, their heart rate rose 35 beats per minute, consistent with what we use to diagnose POTS. POTS is much more than just a high heart rate when standing, but the control of the heart rate was normal, and control of the vascular resistance, the sympathetic nervous system, was normal. It was just overwhelmed by a low stroke volume. That's how much blood the heart pumps per beat in an upright position. The problem was mostly that the heart became too small. Guess how much the average POTS patient's heart muscle mass is below normal? 25%, equivalent to someone with a spinal cord injury. So when I stand up here in an Earth gravitational environment, gravity is sucking blood into my feet. And we're the only creatures on the planet that stand up. So when you go up into space, all this blood that gravity has pulled into your feet rushes centrally. Over time, what happens is a few different things. First of all, the heart gets smaller, right? And so a small heart, and the heart also doesn't have to work hard to pump blood uphill to the brain. So over time, the heart gradually not just loses volume, but atrophies. Sort of like the opposite of the athlete's heart. We call it the couch potato's heart, right? And so the heart gets smaller and smaller and smaller. You also remember that you're very confined in space in a small capsule, so you don't have access to as much physical activity. You're not standing up, you're not walking, you're not fighting against gravity. And that leads to this phenomenon called cardiovascular deconditioning. When you come back down to Earth and now stand up, and let's say you've now spent 12 hours in a suit and you're hot and you land on the steppes of Kazakhstan and you try to stand up, well, now gravity's working again, sucks blood back into your feet. The heart gets very, very empty, and the body tries to compensate for that by speeding up the pulse, right? You want to get the blood where it needs to go. The heart's just a pump, right? And it pumps the blood that comes back to it. And if not so much blood is coming back, you got to pump faster. So that's why the heart rate goes up. And in some astronauts, particularly those who are susceptible, they actually faint and will lose consciousness. And so the problem, after lots and lots of research, for astronauts is that their stroke volume was too low in the upright position. And that's the sine qua non of the cardiovascular adaptation to spaceflight. How do I know that that's the problem? Well, to convince a skeptical person like you, I'd have to tell, well, if you make the heart bigger and fill it, the syndrome should go away, right? And that's what we found. That now astronauts do lots of exercise in space, and they get volume infusions when they come down to Earth. And in our last set of studies, after 6 months in space, not a single person fainted on the tilt table. 0.